Now, if a soldier is shot, the wound is obvious. If you're caught in a car crash, your injuries get treated. But many of those who suffer from PTSD, post-traumatic stress disorder, are allowed to walk away bleeding from wounds that can't be seen. We're going to take a fresh look in a moment at how they might be healed. But first, let's just remind you of the medical definition. Post-traumatic stress disorder is an anxiety disorder caused by witnessing or being involved in a frightening or distressing event. Any traumatic event has the potential to lead to PTSD. We're talking about military conflicts, but also serious road accidents, natural disasters, sexual assaults, even muggings. Some of the most common signs that you have this are flashbacks to the event, leading to poor sleep, mood swings, and also the inability for many to even talk about what's happened. Well, journalist Matthew Green has spent the last 2 years interviewing traumatised men and women who've been trying to adapt to life outside the combat zone, and those who are trying to treat them as well. His new book is Aftershock: The Untold Story of Surviving Peace. And Matthew, why the untold story?
Well, this is obviously a problem which is as old as war itself. We can go right back in history to hear early accounts of men coming back from combat, haunted sometimes by people they've killed or visions of friends they've lost. That's something that we've seen throughout recorded history. And I think, obviously we're in Britain here, many families here can think back to a grandfather perhaps who fought in one of the world wars, maybe came home and didn't talk about it. I think that's a very familiar story across the country. But what we're seeing now is a change. More young men and women are coming forward earlier, talking about things that they may have seen or done in Afghanistan and Iraq. And they're very much at the forefront, really, of demanding better help and not just ways to cope with their symptoms, but to find a way to truly heal.
The pictures we have behind us as well, these are some of the images of some of the men you've spoken to, both in their military and their civilian garb. And one of the questions you raise, one of many in the book, is we say PTSD, we talk about disorder as if it's something that can't be healed. Would it be better to say injury, something that you can treat?
Yeah, well, I think that's a very valid point, because PTSD was actually elaborated as a diagnosis after the Vietnam War by committees of psychiatrists in America. It was first entered into the medical canon in 1980, and it's since spread as a template, really, that's used all over the world for treating trauma. And there is a question, isn't there, about whether something that in some ways is a normal reaction to a life-threatening or terrifying event should be medicalized. And there are people who see it more as an injury, and I think that's very helpful. I think for many of the people who are battling with this disorder, it's much more helpful to realize that something's happened to them on a physiological level. There's actually a change that's taken place in the brain and nervous system that needs to be recalibrated.
And when you think about that, you've been looking not just at the standard therapies, whether it's kind of trauma talking therapy or medication, but looking at mind-body. Tell us a little about that.
Well, that's right. For 100 years, the standard way psychotherapy has been practiced has been more or less for a psychotherapist and their client to sit in a room maybe once or twice a week and talk. Now, that can be very helpful, and it can be the first step for many people to a recovery. But there's new insights from neuroscience that suggest in chronic trauma reactions, and we're talking now about nightmares years later, feeling hypervigilant as if you're still a soldier on patrol even when you're back home, explosive anger or mood swings. Something has gone off center in a deep part of the brain, and it's quite hard to get at that through only talking. And that's why in the book I investigate a whole range of more mind-body techniques that try to adjust or try to reach those deeper layers that talking alone can't reach.
Yeah, and just very quickly, that also involves giving people tools to treat themselves, doesn't it? Which is also something that might be necessary in an age where we simply don't have the resources to give to veterans.
I think a lot of the coverage of this issue often stresses the awful suffering that men and women often go through, and that's very important that we don't neglect that. But at the same time, I met individuals who'd gone on remarkable journeys of transformation and had emerged with a deeper insight about life and themselves as a result. So we should be looking at how to nurture those processes rather than leaving people to kind of muddle along on their own.
Matthew Green, author of Aftershock, thanks very much.